All right. Well, welcome everyone. Thank you so much for joining to learn more about the Global One Health Fellows Program. We're really excited to see everybody here. My name is Meredith Spence Beaulieu. I am the program manager of the Global One Health Academy and an entomologist by training, and also the co-leader of the Global One Health Fellows Program. And I'm joined by my colleague, Michael. I'll turn it over to him so he can introduce himself.
Hi, everybody. And again, thank you for coming. My name is Michael Reiskind, and I am the Director of Graduate Programs for the Global One Health Academy, um, which lets me lead the Fellows Program along with Meredith. I'm a professor in the Department of Entomology and Plant Pathology, where I'm also the Director of Graduate Programs for Entomology. And I'm excited about what will be our fourth cohort of students.
Yeah.
Um, so yeah, let's proceed.
All right, awesome. So let's dive in. I'm assuming since everybody here is interested in the Global One Health Fellows Program, that you have a little bit of background in what One Health is, but I always like to start there just to make sure we're all on the same page about what we're talking about. So this is a definition from the One Health High Level Expert Panel, which they define One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems, which are closely linked and interdependent. This isn't my favorite definition for a couple reasons. First, that people are animals and both humans and non-human animals are parts of ecosystems. But what it really gets at is One Health is interested in the interconnectedness of humans, other organisms, and the environment, and the various problems, challenges, and opportunities at that intersection between the three. Um, Now, One Health is, I think, a super important concept because our world is rapidly changing. We're living closer together, in closer contact with animals. We have global travel and trade that lets pathogens travel around the globe really rapidly. And so all of these complex challenges really require kind of a holistic approach that understands the nuances and the various systems involved. Um, One Health is not focused just on infectious diseases, but infectious diseases are an obvious place where One Health comes into play. You can think about things like COVID that we know have wild reservoirs, infect people, and are affected by land use change, climate change, things like that. But again, not limited to infectious diseases. One Health is a broad umbrella concept that is just interested in anything at the intersection of human, animal, plant, and environmental health. So things like sustainable agricultural production for global food security absolutely can be a One Health topic. Access to safe and clean water, absolutely a One Health topic, as well as things like biodiversity losses and how we're affecting our ecosystems and what that means for ecosystem services that are provided to humans. These are all things that fall under the One Health umbrella. So, going along with that, we are the Global One Health Academy at NC State. So, we are interested in all things One Health. Our mission is to engage faculty, staff, undergraduate, and graduate students in improving the health of plants, animals, biodiversity, and human society in North Carolina and beyond. And I do like to always especially flag the word plants. Plants are not always front and center in the One Health concept, but they are here at NC State. We really do include plants intentionally in our One Health paradigm, being a land grant university. So I'll turn it over to Michael with that brief background to talk about the One Health Fellows Program specifically.
Okay, thank you, Meredith. The Global One Health Fellows Program is a one-year fellowship program. We started it, I guess, 4 years ago now, and it supports five graduate students across the university. Um, we have looked for applications from all 10 colleges within the university. We have funded fellows from not quite all 10 colleges, but getting closer to all 10 colleges. Um, this includes a $34,000 stipend, insurance, and tuition. But during that year of fellowship, we expect our students to participate in a number of important events. It is not by any means restricted to senior graduate students or students only in doctoral programs. All graduate students at the North Carolina State University are eligible to apply. And I will let you know that we have a rubric that includes a sliding evaluative scale for students at different stages in their graduate careers. And so not only are we encouraging of students across the university, as well as at different stages, first year incoming versus fourth or fifth year PhD students, but we actually are, I think, able to evaluate them fairly across those different stages. Yeah, go ahead. Okay. So just as an example, in the 2026 cohort, we had 61 applicants, and five were selected as Global One Health fellows. So what is that? Slightly less than 10% rate of success, which is not to discourage anybody, but just so you know, we have very good applications. We have a very intensive process that I think is incredibly fair. Um, and we get excellent students who are the fellows. So I won't talk about each of these fellows, but you can see that they come from a variety of different colleges. Actually ended up with some fairly early stage fellows this particular cohort, but that's not always been the case in the past, and very diverse. Okay. Um, Again, just for, larger sample sizes, you can see the cohort the previous year, quite different. In this case, we have, fifth years, like Bradley Skolton just finished his PhD, and Lydia was just starting, and now she's right into it. So, across many different colleges and stages. Okay. We do have some expectations of the Global One Health Fellows during their year that they're on the fellowship. They are expected to take a currently 2 credit course in One Health. This is a course that is offered at NC State, but is joint with Duke and UNC. It meets Monday evenings, actually, in Durham. So that part's can be a little bit of a challenge, but really nice to get a different perspective and interact with students from other universities, other programs entirely. Sometimes we have medical students, for example. You are also expected to do a 1 credit Global One Health seminar course. For this cohort, we're doing that in the spring. Not entirely sure whether we'll do that in the fall or the spring. The One Health course that I just mentioned on Mondays is always in the fall. So this year we decided to spread it out a little. We also have bespoke 1 credit, or bespoke monthly professional development meetings. Either we've designed them or or we take advantage of some of the programming that the graduate school or the libraries provides, depending on the month. Um, then we in April of each year we have a One Health Research Symposium. We bring in a renowned speaker. In this April, we're bringing in Tony Goldberg, who probably doesn't mean anything to many of you, but is a specialist in zoonotic pathogens, particularly in primates, as well as the pathogens that are passed from humans into wild primates. And I encourage you all to see it. He is an excellent speaker, and he talks about chimps and monkeys and people, and it's fascinating. He's at University of Wisconsin. So we do that research symposium. Students are expected to participate and give talks. The fellows are, as well as some others. Um, oh, okay. That's what I get for not reviewing our slides. We did this last year. So here's some examples of kind of our professional development areas. We include academic skills, can be anything from like, building databases of literature, but also the so-called soft skills, which everybody knows are not really soft, but things like communication, networking, how do you meet people? How do you give a pitch to different audiences that really sells your scholarship, et cetera? And then One Health career development. And we try to be diverse in our interpretation of where our fellows may end up. And so, for example, just last week, our fellows went out to BASF and had a tour of their facilities and a panel discussion with some BASF folks whose careers have been at BASF. So that's industry. Some years we interact with government, state or federal government. Maybe next year we'll do an academic focused one, although that's, kind of preaching to the choir, as it were. And so we have these, various professional development events. And then the One Health Research Symposium is an afternoon in April. I think it's April 15th this year, maybe.
I will double check that. That
I think
sounds
it is.
right, but I will double
Because
check
I
and
was
I'll
like
put a
thinking
link in the
tax
chat.
day. I better get my taxes done before the
Yes.
deadline, right? And so that's a great opportunity. We usually have very good attendance, 100 plus people in the room, plus a great speaker who does a kind of keynote address, and an opportunity to share our results, our science. Okay. Um, we also will help facilitate, it's not a requirement of the fellowship, but we will help facilitate finding a mentor in a different discipline than the one that you're doing your degree in that can provide a One Health perspective. That doesn't necessarily mean the person is a One Health specialist. It means they're going to provide a different discipline, and you are going to act as the kind of One Health nexus of connecting between different disciplines as well. And we will help facilitate that. Like I said, it's not a requirement. This is something we kind of hope our students will take advantage of, but we don't require it. And then we also have some social events, so mixers for the fellows and their advisors, in the hope that the interactions between the fellows are as important as the interactions of the fellows with Meredith and myself. Okay,
Yeah,
thanks.
thanks, Michael. So I'm going to talk a little bit about the application and kind of eligibility criteria. One quick update that I wanted to make from what Michael said, and this is a change for this year, so no worries, Michael. We did
Forgot.
actually, yes.
I'm so sorry.
So in previous years, we had it open to all graduate students, but this year we did switch to limiting to PhD only. That's primarily because we are starting a Master of Science in Global One Health, and I'll have our first students in here this fall. And those students would probably be extremely competitive for a fellowship like this. But the goals of this fellowship are actually to get people that are in other disciplines thinking broader about One Health. So it's a very different thing than somebody getting a degree in One Health. So we made kind of that clear demarcation this year that it's PhD students only, starting with this cycle. But like Michael mentioned, it is open to students at any career stage within their PhD, from incoming students that haven't yet started at NC State and it'll be their first semester next fall, all the way up through fourth year plus, as long as you have a year remaining, because this is a one-year training program. And this can truly be from any college, any discipline, any sort of topical background, as long as it fits within that One Health umbrella. And One Health is very broad. We define it broadly. So we want you to articulate why your research aligns with the One Health framework. And as long as you can do that, you are eligible and encouraged to apply. Your research does also have to align with one or more of our Global One Health Academy thematic areas. But again, these are very broad. And so I think for almost any research area, you can probably articulate how it fits within one of these themes. The themes are food and water solutions, infectious diseases, which includes things like antimicrobial resistance, and climate and global change, which is very broad, can encompass things like biodiversity losses, of course, climate change, land use change, anything along those lines. The application itself, you'll submit through a Google form. The components are a research statement, which is 2 pages maximum, 12-point font limit. And in this statement, you want to describe your current or intended research. If you're an early stage student and don't quite have your research yet, that's totally fine. But what we're really looking for in this is, yes, some details about what you're doing, but also how your research aligns with the One Health framework and with a Global One Health Academy thematic area. Your task here is really to convince us that your research is a One Health research project and interesting through the One Health lens. You also have a personal statement, which is 1 page maximum, again, 12-point font limit. And this is the opportunity for you to tell us about yourself. What has been your research path? Why are you interested in One Health? Why are you interested in interdisciplinary training programs? What would you contribute to a cohort like this, and what would you gain from it? And then you also have a CV, and there is no page limit on the CV, but keep it reasonable. Please don't give us a 100-page CV. But with all of these, think about this as a complete application package. In any of these documents, you can be highlighting your research, you can be highlighting your interest in interdisciplinarity, in team science, in One Health. What are the experiences and skills that set you apart? And really thread that throughout all of these documents. Take the time to personalize your CV for this application because the other materials are short. So your CV can be a space to put some extra things in that didn't quite make it into your statements. And then finally, we do request that you have a letter of recommendation from your PhD advisor. If you are an incoming student, the letter of recommendation can come from a previous mentor because we recognize that you may not have a deep relationship with your academic advisor at NC State yet because you're likely just starting to chat with them. So the recommendation could come from a previous mentor, but it has to be submitted by your NC State advisor. And that's because we have a Google form that your NC State advisor has to acknowledge they understand what this fellowship is, the requirements and commitments that you would be making if you're selected, and that they're you doing that. So that's just one kind of nuance to be aware of. If you're co-advised, so advised by more than one person at NC State, please only submit one letter. You can either choose one of your co-advisors to submit the letter or have them do a joint letter. If we do receive two letters of recommendation, we will only take the first one. And again, work with your advisor to try to tailor this recommendation letter as much as possible because that is another place to share things about you. So that's the application itself. And then I'll turn it over to Michael to talk about generally kind of what we're looking for in these proposals.
Okay, thanks, Meredith. What we're looking for are projects that are centered firmly on One Health. However, I would note that this doesn't necessarily mean that, whatever, if you're in the fourth or fifth year of your PhD and you've been working in this one area, that suddenly, you're expected to have already done a bunch of One Health related research. It's really about the articulation of how the research is at the intersection of these multiple health domains, human, animal, plant, and or environment. It's that articulation. It's the potential for what you're doing, what you are interested in at a disciplinary level to be more broadly applied in an interdisciplinary framework. And so um, Along with that, I would also say, although when we are reading your research statement and you are presumably articulating and proposing how your work can be centered firmly on One Health, um, that there's some kind of, realistic approach to that. It is not something like a contract where we then expect you to follow through for your dissertation work in that, kind of One Health aspect. So it's really a testament to how you can articulate um, the potential for a One Health research within your area, versus kind of actually being able to do it. And so in that way, I would say think broadly and creatively about how what you do can be applied in that way. Okay. The other thing that we are looking for is, we are building a cohort. It's not a big cohort, right? 5 students. And so we are looking for students who we think will both benefit from and contribute to an interdisciplinary cohort. So we use evidence of prior interest or experiences in interdisciplinary work. And also, we're looking for a clear articulation of how this program would impact your research and your career path. Um, and so, keep that in mind as well, particularly as you're writing your personal statement. So focusing on kind of how past experiences in which you've encountered a diversity of different approaches to a problem have, helped you be a better person, be a better, scientist or better researcher. So yeah. Um, okay.
Yeah, and just two things that I like to add on. The first is that with our scoring rubric, The research pieces and the kind of like soft skill personal attribute pieces are weighted equally. So the personal statement is important, and the articulation of why you're interested in being a part of this program is important. We know that funding is one of the reasons, but beyond that, like what do you hope to gain from this? Really spend some time thinking about it and articulating that well, because the research piece and the personal piece are weighted equally on the rubric. The second thing that I like to emphasize is that you are writing for a broad audience here. This proposal is fairly tricky to write because it's short, and it's important to have enough detail that if you are assigned somebody that is an expertise in your discipline, you want them to understand the methods of what you're doing and why it's an exciting research question. But you don't want to get so in the weeds that you lose somebody that's completely outside of your discipline. We do our best to assign at least one reviewer from within your discipline and at least one reviewer that is very outside of your discipline. So, like an engineer getting somebody in humanities to review the proposal, like that sort of very disparate perspective on the proposal. So keep that in mind when you're writing. Avoid jargon when you can, or define terms at least, and really think about the broad implications, but then do have enough detail that somebody in your field can see that you're doing sound science,
Yeah,
which is tricky to do in 2 pages.
I I would also say that because we get at least two reviewers and usually somebody who's close to your discipline and somebody who's not, um, the best ones are able to thread that needle and so really work at it, and it really comes down to the ability to communicate your ideas effectively. So
Yeah. And the final thing that I want to say, which I meant to touch on when I was talking about eligibility, we really do want researchers from all backgrounds in this program, because one of the key things that we like to do is bring together people from different disciplines to learn from each other. So you do not have to be a natural scientist studying like something directly about infectious disease transmission to be eligible for this. If you're doing educational work that's related to One Health, amazing. We love that. Communication work, really any research from any college can be eligible as long as you can articulate the One Health fit.
yeah.
All right. Well, so that's the end of our formal presentation. We will stay on for questions. I see some come in the chat, so we'll go to those in just a moment. Did just want to briefly remind people of the timeline here. Our applications are due January 19th. And you can learn more at the website linked here, or by scanning that QR code, which takes you to the full call for applications. And of course, feel free to reach out to Michael or myself if you have specific questions. We're always happy to answer questions or have a quick chat about whether your research would be a good fit for the program. So please reach out if you would like to speak with us more. But with that, I'm going to close the slides so that we can see everyone. If you want to turn on your cameras, you're welcome to do so, and we'll answer some questions. I'm going to go straight to the ones in the chat really quickly. There was one that was direct message to me, so I'm going to read that out first. Are there any structural guidelines for the 2-page proposal, like backgrounds, objectives, research question, etc.? No, we do not prescribe how you write that, so that is open to interpretation. But again, just make sure that you are covering kind of what is the specific question that you're studying, and broadly, what are the methods you're using to approach it? And also, how does it align with One Health? How does it align with one of the GOHA research priorities? And kind of what's that broader picture? And however you would like to approach that within your 2 pages is totally fine. The other question from the chat, are we considering the personal statement to be graded under the soft skills rubric? It's not broken down that way in the rubric. So the rubric is asking about things like strength of research or research potential, alignment with One Health, potential, I'm forgetting the exact rubric categories, but things like potential for interdisciplinary contributions in a team setting. And that evidence can be gained from anywhere in the proposal. So that could come from your CV, it could come from your personal statement, it could come from your research statement. So just be thinking about these personal/soft skills and your research piece throughout all three of the documents you're submitting, as well as the letter of recommendation.
Yeah, don't sleep on the CV. That's a real opportunity to show those soft skills and your prior experience with them.
Yeah.
There's a question about participation after the year funding. And we're very inclusive and we stay in touch with our fellows and we invite them to many of the things and the symposium and sometimes professional development opportunities. There will be lots of opportunities to interact with the prior cohorts during the fellowship. It's not really a requirement. We kind of get you for the 1 year and then hope that you want to participate.
Yeah, absolutely. I would say you get a lot of emails from me during and after your fellowship about opportunities to engage. And some of our fellows take advantage of that. And I think that there's a lot to be gained from that. So, for example, with the professional development workshop series, last year, we did a site visit and a panel discussion with people from various areas within the North Carolina state government. We invited that year's cohort, but also previous cohorts. This year we did industry and same thing. So like last year's cohort that didn't get an industry tour can still get their industry tour this year. So there are a lot of benefits once you're in the community. We keep you involved with the community to the extent you'd like to be.
There's a question about the research statement and should it focus on a 1 year project or is it acceptable to outline a longer term research agenda? Um, I think it's probably even preferable to have a longer term research agenda. Um, I think that it is I think there is a pathway for a very competitive research statement that outlines a 1 year or a shorter term project that, maybe is going to make it into the dissertation, but that would be a very high bar, I think, for people to meet, because often people are, again, at different stages and they're well into their disciplinary research. So I think you can do either, and I think most of the applications kind of outline more of a longer term research agenda or vision than a very defined specific program.
I'm
All
going to
right.
go to Amina with the raised hands, and then I'll jump back into the
Okay.
chat. I have had a few messages just directly to me, so I will address those, but we'll go to
Okay.
Amina first.
Hi, I was wondering if you've done another training grant through the school, are you still eligible to do this one?
Yes. Yes.
Yep, absolutely.
Yeah.
That does not make you more or less likely to receive this, but I will say a lot of training grants do focus on interdisciplinary approaches, so that could be something to draw on if you've been a part of a program like that.
Thank you so much.
Yeah, let me grab one from the chat and then we'll go to the next raised hand. So one that was messaged directly to me, are you able to include graphical abstracts and or figures within your research statement? Yes. You still have to stay within the 2-page limit, but you can use those 2 pages however you like. So if you feel like a graphical abstract or a figure will be a compelling addition, given that you'll have a very diverse, disciplinarily diverse set of reviewers reading your application, please include it. We'll go to Abdul Rahman with the raised hand, and then we'll hop back to the chat.
Hi, yes. So I have a question about citing AI. So, like, if I have, for example, my CV and research statements, I wrote myself, and then I send it to, for example, a human editor, professional, right? And then maybe I want to revamp it and I run it through AI to make little tweaks. Or do I have to list all these things? Like, is that all necessary? Like the human editor and the AI making like tweaks of like, different vocab usage and rearranging of things.
Michael, so this is the first year we've put that AI citation bit in the application instruction. So we might be kind of figuring this out in real time. So I'll answer what I think, and then I'll turn it over to Michael for his thoughts as well. I think we are most interested in your use of generative AI. So, like, if you are going to Chat GPT and putting in a prompt to have Chat GPT write your personal statement
Mm,
to tailor to our application, we would definitely want to know that because we want to see how you're thinking, how you're approaching this, what your interpretation of One Health is.
mm,
Um, similarly, if you're using, a generative AI tool to do like a literature review or something like that could be a good use of it perhaps, but we'd want to know what you used and how you used it. So you would cite, I used ChatGPT to do X for this. I am less concerned about the like used Grammarly to check my grammar type things.
Mhm.
But certainly, I think adding a citation to Grammarly for grammar correction would be fine to do. But Michael, what are your thoughts on this one?
Yeah, I mean, I would agree. I think anything, it's always grayer than it seems, but anything that you've used AI to do something whole cloth, versus restructuring a sentence definitely needs to be cited. I'd rather, honestly, a short statement describing your process. Though I recognize using a human editor, um, you know, even an advisor is not prohibited and in fact is kind of good grantsmanship, and I
And we
don't want to
don't
take
ask
away
that
from that.
you make comments about that. So I think it really
Right.
is just the
Right.
AI.
I mean,
Yeah.
I think
No, I
I,
think
th I think in my experience, if somebody is overly reliant on generative AI, I mean, again, I wouldn't want to bet my life on, being able to notice that. But I think in the end, it doesn't read as well as a very well crafted, from the brain of the students proposal. So hopefully, to some extent, it doesn't get rewarded in that way.
mhm.
But I would say like I don't think in any way we would, if somebody discloses, we would hold it against them.
Okay.
And so in that way, I'd rather you just disclose,
Right. Yeah.
and be like, okay,
Yeah.
good, you know?
Agreed.
Yeah.
And so I think what we're thinking of is if you do use generative AI in any way, you would include that in your reference list,
Mhm.
and then just like put a few sentences about like, here's my process or here's what I used it for. And we're not banning the use of AI for this. We're just interested in how did you use AI because we're trying to disentangle kind of the independent thought processes from the very useful and efficiency helping tools that are out there. I'm going to pop to the chat really quickly just because there's
Thank you.
Yeah. No problem.
citation question that I think goes with this. Yes, you're welcome. So what are the guidelines on works cited for the research statement? We do not have a particular like citation format or anything that you should use. However, you might want to use a numbered format to save space in your proposal. The references themselves, so like the actual reference document, works cited document that has the information about the references does not count towards your page limit, but any of the in-text citations would. So if you're doing like Spence Beaulieu et al. 2025, those words are going to be taking up your 2 pages. So you might want to do a numbered citation reference style. But usually it's good to include references. It shows the people within your discipline that you are drawing on published knowledge, that you understand the space that you're working in. And again, that doesn't count towards your word count outside of the in-text portion. Um, let's go to the race,
Well, there's a,
Alejandra. Oh, sorry. Was there something else in the chat that was relevant?
I was just going to say there is something about submission, and I thought we could clear that up really quick.
Oh, yeah, there is an application or there is a link to submit the application. If you go to, I'll post the link to the call in the chat. At the bottom of the call, there is a section that says submission instructions and deadline. And there is a link to where your application packets should be submitted and where your advisor recommendation should be submitted as well. All right, Alejandra.
Hi, yes. I was wondering if it's possible to apply as a 4-year student and kind of like extend my program by one like additional semester because I understand that this fellowship is like 1 year. So I was wondering if you can apply when you are like only one semester to finish or something like that.
Not one semester. So it's fine to apply as a fourth year if you have a year remaining. But we would not want you to apply if you're going to graduate within a semester because this is a 1-year fellowship program. So you would be if you apply and you're selected, you'd be starting in fall 2026. And technically your term would end in the summer, the end of the summer 2027, but as long as you have through May of that year, that's when kind of all the required activities would be taking place.
We we
Oh,
have had
okay.
students finish and graduate while on this fellowship, but in the spring, and they've of course done all of the requirements associated with the fellowship. You know,
Okay, perfect, perfect. Thank you.
yeah. Um, there's a question in the chat. At the end of the 1 year, is there a final project that GoHa fellows need to turn in independently or together? And the answer is no, although we strive in our seminar course, which is a 1 credit seminar course, to at least consider a review paper or some kind of product that might come out of that experience. Those are harder than they sound, honestly. And so we've both of our cohorts that are completed have at least work in progress on those regards, but it's not a requirement.
Yeah, but it is an opportunity. So in
Mhm.
the seminar course, we'll explore a particular topic through a One Health lens, and writing up a paper is an aspirational goal from that course, but again, not a requirement in any sense. Your requirements are the activities of the fellowship, which are the monthly professional development workshops, presenting at the One Health Research Symposium, and taking the 2 courses, and then attending the various mixers and things like that. Um, let's see, another raised hand. We'll go back to Abdul Rahman.
Yes. Hi. Another question. So if my research is about like diseases, and it's currently applicable to human and animals, but I can be creative and show the potential for it to be applicable to plants, for example, then this is something like you guys are looking for when you're talking about broad, like being creative and broad. Is this right?
Yes, I mean, the only caution I would give with regard to that is, I don't know, like say you work on viral pathogenesis and you can work on plant viruses and animal viruses and human, which are animal, whatever,
Mhm.
um, but you're still down in like the, molecular interactions. Just remember, one of your reviewers might be a sociologist. And if you're trying to tell us how important, this one protein is for, binding, just be sure you can also bring it up to a level where you're like, and this is like generally important because this will lead to the next generation of vaccines or what, you know what I mean? Like, or whatever.
Uh,
Like you got to still sell it, even though, so I guess what I'm saying is it's not enough to just hit all of the like, animal, plant, and human kind of health aspects. There is something, um, kind of emergent properties about One Health that is kind of also what gets cooked into it. So, if you're a virologist, and I'm not saying you are, I don't know actually, but if you're a virologist and you are working on blinding viruses which affect plants and animals or whatever, but you are still only like at this kind of virology disciplinary like aspect of it, that's probably not going to read well enough to all the reviewers. Like it might be great. It might even be really one healthy. It just may not quite, you know, get people excited about it from an interdisciplinary standpoint. So that, you know,
Yeah, and I would also say that we don't expect that every proposal have human, animal, plant, and environment. You do not have to have all of those dimensions. What we're really looking for is that you have at least a couple of those and that it's a really compelling interdisciplinary thing with broader health implications. So it may make more sense, depending on what your research is, to really articulate here's why this is super important at the human and animal interface, and here's how the environment comes into play, and here's why this is a really grand challenge, than trying to say, and it can be extended to plants. So you do not have to include every dimension. You have to include at least a couple, and then just really articulate kind of that One Health framework and kind of like the ethos behind it.
okay. Thank you.
Yeah, you're
there's
welcome.
a question about timeline in the
Yes.
chat.
Yes,
Um,
so
yeah.
applications are due January 19th. We have a pretty robust evaluation process for these where we have external and internal reviewers. The review process ends up taking about 4 to 5 weeks, depending on how quickly we can get reviews back in. And then there's, of course, the decision-making process after we receive the reviews. So basically what we're looking at is early March for notifying people of selection. And then if you are selected, you would be starting your tenure as a fellow in the fall. Yeah. I do have one other question that was direct message to me. If you're in between labs because of rotations and thinking of joining one of them but haven't joined formally, can you still base your research statement on a potential project? Yes, absolutely. I think the challenge with that one is who is submitting your letter of recommendation. But if you have specific questions about that, you can reach out to us and we can figure out a way to get around that. But yes, we're looking for, so with fellowships, generally, you're kind of funding the person and not the project. And so if you are talking about, here's a project that I plan to do with this advisor, and it's a really compelling One Health approach, and we can tell that you've thought about this well and you'd be a great fit, and you end up going to another lab and doing something completely different, that's okay, as long as it's still something One Healthy, because you're awarded based on kind of what you submitted and how you think about the questions and what you bring to the table.
Yeah, I would say for those of you familiar with the NSF GRFP, it's a little bit like that. I mean, we actually don't know what your final dissertation is going to be about. We know what program you're in, but we don't know. And so, write the best proposal you can for this opportunity, you know.
So I think we've cleared all the questions out of the chat. Are there other questions in the group? You can do a raise hand or post in the chat. I'll give people a minute to do that. While you're doing that, I'm going to post in the chat a link to our One Health Research Symposium in case you're interested in attending. It's actually April 14th this year, so very close to tax day. And there will be more details about that event very soon. We'll have the full event page up in January, but you can at least see our keynote speaker and his topic. Well, if there are no other questions, I do just want to close by saying if you have applied for this in the past and didn't get it, please reapply. I always like to emphasize how many applications we receive, not to scare people off, but to just let you know that we receive a lot of proposals and a lot of them are really great. And we wish that we could fund more than the 5 slots we have every single year. So it is a very competitive proposal process, and I say that to encourage you in case you've submitted before. That doesn't mean that we didn't like the proposal. It just means you weren't selected, which doesn't tell you anything about the value of what you submitted. So if this is of interest to you, please apply, please keep applying, and do let us know if you have any questions as you go through building out your application. Michael, anything else you want to add before we close?
No, thanks for everybody who's attended this. I guarantee you your proposals will be better having attended this. So taking a step in the right direction.
Yeah.
Yeah.
All right. Well, thank you, everyone. Thanks so much for coming out. We look forward to your submissions.
Okay. Bye-bye.
Bye.